Hello, happy football Sunday. Also, this is my husband's team, not my team. I'm a Seahawks fan. I am studying right now. It's 7:30 Sunday night, the 3rd of November. Trying to study while my husband is literally screaming from the living room playing video games, and I can't even hear myself think, but it's fine. I have a exam on muscles and the TMJ and head and neck anatomy tomorrow. It's in our lab, and you have to like look at a muscle and like say what it is, and also know for the major muscles like the origin, insertion, action, and stuff. And then I also have a pharmacology quiz. Somehow I do well just like memorizing structures. Like when we had our head and neck anatomy identifying like cranial bones exam, I got 100% on it. To me that's easier than like really understanding how things work. Here in pharmacology, I just don't even know what's really going on, but so that's where I am. And I will talk to you guys in the morning and see how I'm feeling after this possibly long night. Okay, bye. Okay, so it's Monday, and I'm just leaving school. It's 4 o'clock-ish, and I did not film this morning because I didn't have time, so it's fine. Update after school. So I had my pharmacology quiz and my head and neck anatomy identification of muscles and like the TMJ like parts and ligaments. So I feel like today was the worst I felt after a day of like exams. Not like I failed them or anything, like I think I did fine, but like I didn't do that great. So in pharm, I definitely got like, I don't know, I'm like fingers crossed that somehow I got an 8 out of 10. I'm feeling like I might have gotten a 7, which would be my first C on anything thus far, which would be sad, but also like props to myself for not getting below a B on anything up until the 8th week, or not 8th week, up until the 6th week, which I think is pretty awesome. Honestly, I've done really well so far, so I do have like good cushion. Right now I have like an 88.9 or something in pharmacology, so it's really okay, but I just like was hoping to like get like a B on everything, but it's fine. And then we had our muscle like exam, and I'm just like really like kind of butthurt about it, to be honest, because we all remember her telling us that we only had to know the origin and insertion of like the major muscles, and not like she said like she wouldn't ask us like the minor muscles, like that kind of question. So I only studied the origin insertion of like the major muscles, like definitely the sternocleidomastoid, because she told us that was one for sure that she would ask us, so obviously I knew that one. I studied like the origin insertion of the muscles of mastication, because she did say on our objectives that was like those muscles like to know and stuff, and then like a couple other ones, and that was it, because I felt like those were the major muscles, and she made it seem like she would only be asking a couple questions about that. And so like right before the exam, I was like, hey, I don't know if you can like tell me this, but like how many origin insertion questions can we expect on the exam? And she said, oh, every single muscle is gonna have an origin or insertion question, not necessarily both, but like it'll have one or the other, or maybe like function or whatever. So every single one had either origin or insertion, and then another question like function or like something else about it. And so like all of us were like, we only studied the major muscles because that's what we were told. So that was kind of irritating. And then also there was a muscle in there that I literally had no idea what it was because it wasn't on the objectives. And I thought like she gave us like a study guide with like objectives of like all, and it looks like a list of muscles and like all these other things and ligaments and like TMJ and stuff to know. And then there was a muscle on there. It was the levator scapulae, and it wasn't on the like study guide objective, so I didn't study it, so I got that wrong. And so since I got that wrong, I obviously got the 2 supplementary questions underneath of it wrong. So yeah, I'm just like kind of frustrated with that whole thing. Like, she read over the answers and like it's hard to tell how she will give credit because like some of them there was multiple functions, not just one function, so I don't know if I'll get like whole credit or like partial credit, you know, so I'm not sure exactly how she's gonna grade it. Like, I'm sure I passed it, and also there was 2 extra credit questions and I know I got them both right because she did read through the answers. So I'm just hoping I got a B on it. I'm just kind of disappointed. But then she told us after, she said usually like she does try to make the study guide objectives like everything that she would ask on an exam, and she did say that not having the levator scapulae on there was an oversight on her part. But then she also said, you know, anything from her PowerPoints or reading is fair game for an exam. So I guess that's just sucks, man, but whatever. I think I still did good, and I'm just like super hard on myself, but oh well, you know, this is about to happen. And one positive thing though is like we have a case study report due on Friday for pharmacology, and I've been really stressed out about that because I didn't have a patient for my case study. We had to find somebody that takes at least 4 medications and, you know, ask them a bunch of questions and write a 4-page report on like case study. While I was in school, I messaged somebody that I know that I was pretty sure takes 4 medications at least, and they said yes, and they agreed to be my patient for my case study. So that makes me feel a lot better that I actually have someone now, because I was like, oh my gosh, that's literally due on Friday, 4 pages long, and I don't even know who my patient is going to be. So at least I have a patient now, so I'm feeling a lot better about that. So like focusing on the positives here, you know, the hills and valleys. The valleys were my 2 like quizzes, my quiz and exam like could have gone better, but I think I passed them. Hill, I found a case study patient. So we're gonna focus on the positives here, and then I'm gonna go home and study. I have a prevention quiz tomorrow, and then I also have an identification exam of posterior teeth, so really gotta study for that. I'm just like trying to get through this week because on Monday, like next Monday, we don't have school because it's Veterans Day, and I'm just so excited about that. Oh, and then also we had clinic this morning, and we practiced doing intraoral and extraoral exams on each other, which is pretty fun. It went really well. We had like our textbook with us and just like went through it and like tells you step by step exactly what you have to do for the EO, IO exams. It was fine with the book, but like now I have to memorize like every single thing you have to do for an EO and IO exam. So yeah. And then Friday we learned how to probe, and I'm so excited. We actually are like really doing instrumentation finally. So those are the hills, guys. Gotta focus on your hills, or the peaks. People say peaks and valleys, whatever. The high points, acknowledge the low points, learn from the low points, move on, focus on the peaks. Motivation Monday. Okay, talk to y'all later. Okay, it's Tuesday the 5th, and I'm just leaving school. So I got my results of my muscles identification exam, and I got like a solid B on it, I think, like an 86% on it, so I'll take it, considering I literally had no idea that every single muscle was gonna have an origin and insertion question on it. So for like just using a really good educated guess on a lot of things, I'd say that's pretty dang good. And then today we just had a prevention quiz this morning on like different kinds of toothbrushing techniques and indices, like plaque indices and stuff like that. And I only missed one, I think 11 out of 12. So that was pretty good. And then we just had, like just now, had a dental anatomy identification exam on posterior teeth. She read through the answers, and I know I got some wrong. I think I got a B on it, I'm pretty sure. I did not get the extra credit question, barely. But she said it was all or nothing, so I'm not gonna get any points for it, but whatever, it was extra credit, so it's fine. I just felt kind of like I didn't have enough time. Like, we have a minute and a half, so like you're at stations, so there's 22 of us in our cohort, and it's broken into 2 different exams essentially. So there's 11 stations on one side and 11 stations on the other, so you just pick one of the sides, and then you start at one of the 11 stations, and then you have 90 seconds at your station to answer the question. So it'll be like a tooth laying there on a table, and you have to say like what the tooth is, or like the tooth number, the name of the tooth, and then on some of them it'll have structures marked, and you have to be like, name whatever like structure that this is with the marking on it. And some of them there was like multiple, like a lot of them had like 3 different parts to it, like what tooth is this, name this, and like you only have 90 seconds at each station. And a lot of us felt like, I just felt like I could have done better if I didn't feel like so stressed for time on the ones that had multiple parts to it, because like 90 seconds just to look at the tooth and say like what tooth it is fine. But when you feel like really pressured to like do it really quickly, because then you have to answer questions, like I think I made dumb mistakes. So that's just frustrating. I just felt like really time pressured. It's alright. Like I'm trying not to like get upset when I don't get like an A on everything, and I really don't know why I'm like struggling so hard with this, because before this program I was never that person at all. So I just don't know if this like environment has made me like harder on myself, maybe because like in regular college, you know, it's just less, it's not like we have to compete with each other, like we're all in the program, we're not like competing for a place in the program. But like in regular undergrad, like prereqs, it's just less competition amongst your peers, I guess. Like you're obviously trying to do your best to get into the program, but it feels different, I guess. Like before, in like a class, it'd be like if I got an A or a B on a test, it'd be like happy with myself. And if I got an 85 on an exam, like a difficult exam, it'd be like cool, like I got a B, like an 85, that's good. But now I don't know why, I just feel like that's not good enough, and I just feel like it's because I'm in a group of like, you know, 21 other smart people, and we're all just like kind of like, I don't know. But I mean, it does help me have good grades, I guess, but I feel like it just makes me more sad when I don't do as well. So something I'm trying to work on, because to be fair, I literally don't need good grades in this program at all, which sounds bad. Like obviously I care and I want good grades, but like literally I can just pass all of these classes and I will be just as much as an RDH at the end of the program as someone that gets all A's, you know? There's no need for me to like beat myself up for getting a freaking B. Like, I don't know, it's weird. Like, I was never like that. Tomorrow I actually don't have any kind of quiz or exam, which is like such a blessing. I'm gonna start my case study. Hello guys, I've been slacking big time and haven't vlogged, I don't know, like in at least a day, but yesterday we literally had nothing, so you didn't miss anything. Going to class, we just have a quiz in dental anatomy, and I'll talk to you guys after. Okay, I'm home from school and I got 100% on my dental anatomy quiz today, which I'm happy about because I just like pretty much reviewed it during my lunch today. I mean, we've had, so like our quiz was on mandibular molars and also third molars, and we've had a quiz before on maxillary molars, and we've already done our identification exam of like molars, like having posterior teeth, all posterior teeth, so molars and premolars. So like I've already had to study the anatomy of molars before. I mean, there are some differences between maxillary and mandibular molars, but there's like a lot of similarities as well. So I was like, yesterday I was like, I don't really want to study, I just want to chill and watch YouTube, and so that's what I did, and then it all worked out in the end. So, but now I'm sad because I have the rough draft of my case study due tomorrow, and I've written about a page so far, and it's supposed to be 4, and I just like am so unmotivated. I mean, it's only 10 points, it's a rough draft, but I need all the points I can get in pharmacology. So I mean, my grade is fine. I have like a high B in the class, but we have our next midterm next week, and just in case that goes south, I'd like to have as much cushion as possible. So that's where I am, and I guess we'll see if I can find the motivation to write this. Okay, bye. Okay, good thing and bad thing about today. Good thing is that we had our pharmacology quiz like we always do on Monday, and when I got it back on Wednesday, it said I got an 8.5 out of 10, which is fine and everything, but I looked at the answers and that like I put, and then I looked through his, so to like study, we have the slides like from class, like his PowerPoints, and then he also gives us notes of like he types up more in depth about like all the topics and like posts it online, and then we have that as well. But sometimes he's like weird about the notes, like I don't know how to explain it, but like he doesn't put everything you need to know in the slides. So there's things you have to know from the notes, but then sometimes if you answer something from the notes, he tells you, oh, you know, you really need to focus on what's in the slides, not what's on the notes. It's a really weird and dumb system. I don't know. Anyways, so to the answers I got from his notes, he also has TAs grade his quizzes. So like if, you know, sometimes there can be more than one answer for a question. Like there's a lot of drugs out there, so there can be more than one answer. And so the TAs are grading it just based off his answer key. And so like half the time you probably got more points than you actually were graded because like the TA doesn't actually know everything. I don't know. Anyways, so I emailed him because the 2 questions I got wrong, I missed 1 point on one question and then half a point on the other. And he gave me back the points, even though one of the things that I answered I got from his notes, and he said it's not really that accurate, but that's like legit what his notes say. So he gave me the point for it, and then it gave me an extra point for like pointing out a flaw, I guess, in his notes. So he's gonna like fix the notes, and so I ended up getting 11 out of 10 on this quiz. Like I don't even know how, but somehow so that happened. So yay, positive. So that happened this morning because I emailed him yesterday, and that's what he said back. And then today we had clinic, and I was like so excited about it because this is the first time we actually used instruments on each other. Like today we probed on each other, and I probed on my friend Bree. I took some footage of her probing me, so I'll put that in real quick. You're not limited to it. It's just your... So yeah, and then I probed her, obviously, And I just had a very frustrating, like, time as a clinician today because our instructor today, so the first 5 weeks we had different instructors. Like you'd have one person on Monday and one person on Friday, and like, you know, the same people Monday and Friday for the first 5 weeks. And then this is the 6th week. So then we changed instructors, and so now we have different people Monday and Friday than we did before. But my person that I'm supposed to have on Fridays, I don't know if she's like sick or something, but she's like out today. So we had a different instructor for our pod today. And I felt like it was like I didn't learn anything from her because she only the whole time, and like everyone in my pod had the same complaint. The whole time she was just talking about our ergonomics. Like she was saying, you need to have a good foundation. Ergonomics are so important, which I completely agree. I know I have terrible posture. I know I need to work on it. But this is legitimately the only time. I mean, we are going to be probing again next week and like charting and stuff. But like we're supposed to be comfortable probing, at least decently comfortable probing, and like focusing on how to use like the EagleSoft software for charting it. But literally, we get 10 minutes of like individual time with our instructor, and I swear she spent the whole 10 minutes moving my shoulders, telling me make sure my wrist is like neutral, like all of these things. Like I get it, I need to work on those things, but she did not show me, how to probe. Like I was probing, like I'm so frustrated. I don't even know how to explain it. Like, this is the most frustrated I've ever been after a clinic because I feel like it was literally a waste of my time. Like, sure, I got to, like, probe for the first time, but I could have been doing it wrong, and who knows? Like, because she literally only looked, like, the whole time I'd be probing, and she would not even be looking at what I was doing in my patient's mouth. She was like, your neck is sticking out. Like, she was only talking about my ergonomics the whole time. And then she's like, okay, well, now I only have 1 minute left with you, after she had just kept going on and on about my posture. And I was like, well, we'll have a freaking minute left. Like, what am I supposed to do now? So I'm just really irritated about it. Hopefully on Friday she can like help me out if I'm struggling. I'm also gonna bring home my Typodont. I was gonna bring it home this weekend because we have a 4-day weekend. No, not 4-day. We have a 3-day weekend this weekend because of Veterans Day on Monday. So we won't have clinic on Monday like we usually do. So we'll only have clinic on Friday. So I think Monday I'll bring home my Typodont and some instruments and practice on the Typodont because I feel like I don't know. I just feel like I didn't have any help. Just annoyed. Had to vent. But it's fine. It's going to be a good weekend. No, I can't really say good weekend. But me and 2 other girls in my program are going to go out for food and drinks tonight to unwind after this stressful day. And then I have to study all weekend long for pharmacology because we have a 180-point midterm on Wednesday. That's and all of our tests are cumulative, so this is our second midterm. So we had one already that was 90 points, and it was cumulative, obviously, because it's our first exam. And then now this one is also cumulative, and it's double the points, 180. And then our final is 360 points, and obviously cumulative. So each time it's a little more stressful. I have a low A right now, which is nice. Obviously, if I get lower than an A, I'll not have an A in the class anymore. But I'm just happy to have some cushion. Like, I would be perfectly happy getting a B on the test and having a B in the class. Like, obviously, I'd like to have an A, but I would be so excited to get a B in this class because pharm is hard as hell. So yeah, I'll be studying pharm like all weekend long, and it's not till Wednesday, so I have like a while to study for it, but I need to study like at least a week's worth of material every day. But one nice thing is we didn't get through one of his lectures that he was planning on getting through for this exam, so it will not be on the exam. So, pretty happy about that. One less thing to worry about. That's really it. I'm just flustered about clinic, but whatever. I guess this happens. I'm glad we are at least, because sometimes we like do something in a clinic and then we like completely move on the next clinic. Like, for example, last clinic we did EO-IO exams, and who knows when we'll do that again. Like, maybe when I see a freaking patient, like, no, I'm just kidding. I know we'll do it next term, because next term we'll have a skill eval on it, but yeah, probably not till then. So I'm glad that at least we got to learn it today, and the next week we'll chart, so at least I will be able to practice it again on a real person next week. So that's good. That makes me feel a little bit better. Just wanted to let you guys know how I was feeling. I will see you guys next week. Thank you for watching. Bye!